Hello, nurses. This is Vijita Anish, nurse instructors at Athena Coaching Center. In this video, I'm going to discuss questions. So these are the questions which is very important, and all these questions are frequently asked for Prometric, DHA, HAAD, and MOH exam. So without wasting time, we'll move to question discussion. So I'll share the screen. So you can just read the question and try to understand the meaning of the question and try to eliminate wrong answers. Always when you get a question, you should follow this particular method. You need to understand the meaning of the question and try to remove wrong answer. So you will be able to remove 2 wrong answers, but definitely yes, rest of the 2 you will struggle. So by using all the category, what we learned, you can try to select very important and best answer. So we'll see.
Question number 1, a client has a blood urea nitrogen 68 and creatinine is 6, IV fluid 5% dextrose in 0.9 sodium chloride with 40 milliequivalent potassium chloride at 100 ml per hour. Which action would be most appropriate for the nurse to take? Encourage more protein in the diet and ambulate the client more to increase circulation and take vital signs every hour and question the use of potassium in the IV fluid. Currently, the patient is receiving 40 milli equivalent potassium. And BUN value is 68, creatinine is 6, and DNS with 40 milliequivalent potassium chloride at 100 ml per hour. 1 hour, the patient is receiving 100 ml fluid with the potassium. So which action would be most appropriate for the nurse to take? What the nurse will do? What is the normal value of creatinine? Yes, what is the normal value of creatinine? Its maximum is 1.2 or 1.3. That is the maximum value. So here is 6. And BUN value 6 to 24 mg per deciliter. Okay, and both these creatinine as well as BUN is high. So what is the nurse's appropriate action? Yes. Am I audible? So the answer is, here this patient is with some renal problem because creatinine is high. Creatinine normal value is maximum up to 1.2 or 1.3 mg per deciliter. But it is 6, so it is high. So renal problem here. So in case of renal problem, encouraging more protein is wrong. So you can just remove that. And ambulating the client more to increase circulation doesn't require. Take vital signs every hour. That is okay. And question the use of potassium in the fluid. Here the patient is the nurse has used 40 milli equivalent per 40 milli equivalent potassium is diluted in the saline. Okay, so potassium never gave at this particular moment. Why potassium is wrong here? Yes. And the reason, because the patient has a renal problem. Yeah, so potassium never be administered? So the answer is question the use of potassium in the fluid. Okay. Next, potassium is wrong. A potassium never give the and this situation. So A is the answer. Next. Client is suspected of having hyperkalemia. Which symptom or a sign would the nurse expect to find when assessing the client?
Tall TV.
Yeah. So the answer is tall T wave. You can write hyperkalemia causes tall T wave. And what is the sign of hypokalemia?
UV.
Prominent
UV.
UV.
Okay, okay. And what is the cause for hypokalemia? Causes for hypokalemia. Certain medications will cause hypokalemia. Vomiting causes
Loop.
hypokalemia. Yeah. Okay. Loop diuretic will cause
Diuretic.
hypokalemia. Okay. There are certain endocrinal disorders will also cause hypokalemia. Fine. The signs and symptoms of hypokalemia as well as hyperkalemia, both you have to just remember. So let me just say the signs and symptoms of hypokalemia. Hypokalemia, low potassium, causes weakness, fatigue, muscle cramps or twitching, arrhythmia. Okay. Weakness, fatigue, muscle cramps, twitching, constipation, arrhythmia and constipation. And what are the signs and symptoms of hyperkalemia? Increased potassium. There will be abdominal pain, chest pain, fluttering heartbeat, nausea and vomiting. Nausea and vomiting. Muscle weakness or numbness. What is the cause for hyperkalemia? Causes for hyperkalemia.
Renal failure.
Yeah,
Renal failure.
renal failure. Again, endocrinal disorders will also cause hyperkalemia. For example, Conn's disease, C-O-N-N-S. Conn's disease causes hyperkalemia or hypokalemia. Sorry. Conn's disease causes hypokalemia. Okay. And Addison's disease causes hyperkalemia. Okay. Conn's disease causes decreased potassium. Addison's disease causes hyperkalemia. Okay. What is hyponatremia?
Decrease the sodium.
Signs and symptoms of low hyponatremia. Yes. എന്തൊക്കെയാണ് signs and symptoms of hyponatremia? Sodium കുറയുമ്പോൾ. Yeah, sodium കുറയുമ്പോൾ low sodium causes confusion. Yes. Loss of energy, drowsiness, restlessness, irritability, muscle weakness. Okay. And last is seizure. It will affect mood. And what are the signs and symptoms of hypernatremia? Hypernatremia almost will all cause the same signs. Instead of all other symptoms, there will be extreme thirst. So you can write the signs and symptoms of hypernatremia. It causes extreme thirst, lethargy. Patient will be irritable. BP will be high. Okay. So signs of hypokalemia, hyperkalemia, hypernatremia. Sodium variation, sodium changes will cause alteration in central nervous system, and potassium variation always causes changes in where it causes changes in the heart. Yes. Next question. When the client has ABG drawn from the radial artery, the nurse should prepare to perform which follow-up action? Apply pressure to the site for up to 1 minute. Transfer the blood sample to a heparinized test tube and pack the sample in an ice for transporting to the laboratory. Obtain a second specimen for 10 minutes to compare results. What is the answer?
Pack the sample.
Yeah, pack the sample in an ice for transporting to the laboratory. Option number A, apply pressure to the site for up to 1 minute. Right or wrong? ശരിയാണോ തെറ്റാണോ? 1 minute കൊടുത്താൽ മതിയോ? Yeah, you have to give almost to 5 minutes. Yeah. So അതുകൊണ്ട് അത് തെറ്റാണ്. So the correct answer for this is pack the sample in a ice for transporting to the laboratory. Okay, and next question. Which laboratory test results would indicate that the client is adequately anticoagulated on sodium warfarin during post-operative period when the physician is trying to prevent DVT? Which laboratory test results would indicate that the client is adequately anticoagulated? That is an evaluation test. Which lab value is helping you to identify the effectiveness of warfarin for a patient with DVT? What is the answer? INR or PT? PT ആണോ INR ആണോ?
INR. B.
Yeah, INR. വാർഫാറിന്റെ കേസില് വാർഫാറിൻ effective ആണോ എന്ന് അറിയാനായിട്ട് നമ്മൾ എന്താണ് ചെക്ക് ചെയ്യുന്നത്? Mainly for what is that? DVT.